Good afternoon. Thank you for doing this in English. I don't speak Hebrew at all, so I appreciate that. And I'll keep this brief. As you can see, it's not going to be groundbreaking. I am not a researcher, not a doctor. I'm just a person who likes to lift weights, and that's how I got this position. I've been working with the Combat Fitness Center at school, Paul and myself, for several years, and it's been very valuable coming here and learning from them. So I hope we can continue this. And I want to show you what we at our 3rd Special Forces Group, we take a injured soldier and we'll return them to duty. Let me give you a background for a special operations soldier. For every 5 years of training, it takes roughly $500,000 US to train them. So we want to keep them into the fight as long as we can. We may have a special operator with us 20, 25 years. If he gets hurt at the 10-year mark, we have $1 million invested in him already. To lose that to injury, yes. $500,000 for one operator for 5 years of training, yes. That's what they roughly estimated. So we want to keep them into our ranks as long as we possibly can. Between the U.S., we have career soldiers, and we keep them as long as we can. It's a little different here, I understand, and the challenges are different. But I think the outcomes with rehabilitation, we can always continue to do the best we can. Hence, that's why our program exists. So we try to keep our investment. A 20-year soldier, you have $2 million invested. So what we do is we take, in our program, Paul talked about this morning, we have a bunch of different disciplines underneath one umbrella. So I run a whole program. We have physical therapists, athletic trainers, dietitian, a mental performance or sports psychologist, and strength and conditioning on one staff underneath in one building, and we work together to keep our guys healthy. This is a slide. It'll show you from the point of injury up on the top, and Paul used this slide briefly earlier. I'm going to go more in depth on this. So you take from the point of injury on the very top, one of our soft operators in the top line represents the Special Operation Force. That's the level that we expect our guys to be. The second dotted line, that would be our conventional forces, our big army, if you will. That's where they expect them to be. So you get an operator hurt, he comes all the way down. That's when he will meet with the doctor initially. And we can do many different injuries. I'm going to, because at the end of the slide I will show you examples. If we are in Afghanistan fighting, an IED explodes, one of our soldiers loses his limb, how does he stay in the force? Most armies would say he cannot. We say yes he can, and we've proved that. He will see the doctors initially, and then from that point, after surgery, he will go to our physical therapists. So at our physical therapist, at that point, that's when the initial time to start our rehabilitation. He will meet with our dietitian to start with the process for healing on the nutrition. He will also meet with our sports psychologist to start the healing process to go back into direct action. That all happens at one time. So there's not different stages, that all happens at one time. They will go through the rehabilitation process. When he gets to a certain point, about 80% of his high functioning value, he will then get handed over to our athletic trainer. Our athletic trainer is what you would see on your sports fields for soccer or your other sports. They're going to be the initial person. Well, ours also is with rehabilitation, and they will take them through the rehabilitation process all the way up to functioning to get to the strength and conditioning step. So our physical therapist, like I told you, they'll do it at the point of injury. They'll screen the patients based on if it's a bad injury, if it's an easy injury. they'll ask them, hey, do you have poor sleep? That will affect their rehabilitation process. If they do, if there's some cognitive things, they'll push them to the sports psychologist immediately. And also, like I told you, they'll also screen them and say, we need to get you with the dietitian to look at your what you're eating to help you get back to recovery. They'll ask them their pain levels, and if it's a guy that's lost his leg, believe it or not, pain levels are not that great. We've actually experienced pain levels to be decreased as opposed to an ACL injury because there's phantom pain, but they have managed that quite well, which was surprising to us. Look at functional range of movement. They want to get them, they'll use different tests, whether it be the Y balance drill, the FMS, they'll get different baseline tests just to look and see where they are when they first start. They'll compare those again whenever they get later in the rehabilitation process. Our dietitian, as I told you, this is, and actually I didn't make these slides, I cheated. I had each one of my disciplines make their own slides because I wanted them to tell you what they exactly do. So this will lay out what our dietitian does in each week. So she will work with the injured person each week to take them through what they need to do in order to decrease the inflammatory process. The big one for us in the U.S. military, as you can see, week 1 through 3, she puts no alcohol. Very difficult. But the guys listen to her, I think. I hope. You talk about the hyperbaric chamber, Doctor. We have one, and it's we use that for wound healing and tissue healing. And I like what you were talking because I also have a lot of friends with autistic children that use that therapy and see great advantages. So, sorry, a little sidebar. So thank you. Then she'll go through each week and she will lay out what we need to do. She needs to do lab work, blood work, to get different markers, biomarkers, to find out what they're deficient in to help them recover quicker, then that's what we will do. And she will point that out in each week as she goes through the process. Our sports psychology, our mental performance. Initial phase, he will talk to them, find out what they're thinking, what they're doing, sleeping, find out if they have memory, if there's a TBI involved. He will go through that whole process with them, and then he will work on different kind of drills throughout, and the cognitive drills, the remembering drills. He will go through each one of these, and it's a weekly, sometimes daily meeting with each one of them to make sure that they stay engaged into the recovery process. Very vital role. Paul touched on it this morning. The cognitive, this mental performance, very vital role in what we do to continue to get our operators back into the force. And you will see why at the very end. I want to show you a few pictures that have worked and gotten back into the fight, and this is a very, very vital role to get them back to where they need to be. So after about 80%, they consider 80% of their full functioning value from our physical therapist. Our athletic trainer will get involved. This is whenever he starts working on CNE, he starts working on the proprioceptive that you spoke about. We'll work very heavily there. We'll work very heavily on their full range of motion, getting them back to full range of motion, getting them back to full strength before they're ever handed over to the strength and conditioning specialist. So we will, he will take them through what we call our return to duty operator readiness test that Dr. Mendel spoke about this morning. We did publish a paper on that. I spoke about it here before, and it gives us a degree in which to get our guys back to full functional combat duty, and I'll give you a glimpse of that here in just a second. So he will take them through all of that, preparing them to go back to full functional duty. By the time they get to us with the strength and conditioning coach, then at this point, we want them 100% healthy. We want to be able to say, okay, now it's time for us to say your injury's rehabilitated, let's go to the next level. We want to get you back to your team, we want to send you back into combat, And that's what we start training them for. Very mission specific is what we train them for. So we will take them, we will continue to work with the doctors, the physical therapists, and everyone involved in the process. We talk daily about each individual to keep promoting their recovery all the way to full performance. So this is the test that we came up with. This is validated. We've studied this. This is just what we have come up with. It's 11 events, and how we develop this is we ask our operators what's relevant to you that we can do in a controlled environment that's going to help you be able to do your job better whenever you get deployed. Also, our doctors and our commanders like this because if they can pass this, they say they are 100% healthy and can go back into combat. The initial, actually we're still finding we have over 800 tested right now. Initially in our first designation with this test, we tested all healthy operators. And we started out with just 84 as a validation. We came up with all healthy operators once we got our standard deviation with the time limits and what our parameters were going to be. We found out 25% failed. That's a significant amount out of 84. As we kept going, we kept finding 25% was very true. So after we're at 800 right now, and we are still at 12% fail rate on this test. And that's all healthy guys. We only run the wounded through this is when they're trying to go back. So significant for us to show that it hits all of the parameters that Dr. Nindel spoke about this morning with the speed, the power, the endurance. All of those are encompassed into our one test. Oh, and by the way, that test is all done under a 50-pound load as well. So these are our warriors that actually went back into combat. They went back into direct action, and what you're going to find out is 3 of these are amputees. The gentleman on the right, he has actually been here before with me. Double amputee, he's a commander. He lost his leg actually in an IED blast in Pakistan. And out of 5 people in the vehicle, only 2 survived. Very serious. This, what you see on there, is only after 4 years after the accident. And he was fully rehabilitated. He actually went back into command, redeployed back to Afghanistan, did another rotation, and he is now retired. The gentleman closest to me, he had his was an IED as well, amputee. He just went back to a team. After 3 years, he went back to the team. He's also starting, he has a very good chance to, once he got injured, he's trying out for the USA sled hockey Olympic, Paralympic team. He got very good at that because he had to keep his mind engaged. So, but he's actually full functioning, and he'll be taking his first deployment back into direct action probably within the next 6 months. I'm going to talk about the guy on the right here for a second. He had a gunshot wound through and through. He has actually an IDEO brace, which is a limb salvage device. He is back full functioning on the team. Now the gentleman over on the far side, he looks like RoboCop. He's an above-the-knee amputee. If you would look him up on the internet, he is everywhere. He is a stud. He is the first, and we verified this, he's the first above-the-knee amputee to ever go back into direct combat on a direct action team in the United States military. He had to pass the test that I showed. He is an animal. He is, he's 6 foot 7 inches tall.
How old?
Huh?
How old?
How old is he? He is, now he's 31 years old. And he, before he got injured, he weighed 270 pounds. Now he weighs 240 pounds. So his leg took off a little weight. Said he makes him look slimmer, you know. So these are just the type of individuals. We have many more, but I just wanted to point out 4 to you. They all went through the program. They hit all those domains. We've been very successful in keeping our guys in the fight, which for the United States saves money, which for these guys, more importantly for us and our program, keeps them in direct action with the fight, but it also gives them a life after the Army, which is more important to me, but it also helps our country stay safe. That's all I have, so any questions?